For this technique, we'll begin by taking a 10 cc syringe, removing the plunger, and cutting the tip of the syringe off with bandage scissors, taking care not to splinter the plastic. Next, we'll place the antibiotic powder into the syringe. We have found the paper label from our adhesive surgical drape or wound vac supplies works well as a funnel. The paper turn tag from the surgical gowns may be utilized as well for this. You will keep your index finger under the opening of the syringe while antibiotics are loaded. In this video demonstration, we use 2 grams of vancomycin and 1.2 grams of tobramycin powder for a periprosthetic femur fracture, which will demonstrate its application later in this video. Note the intermittent compaction of the powder with the plunger, allowing for an increased volume of antibiotics per syringe. This setup could be performed on the back table at any point during the case and ready for application at the conclusion of the case. We have found this technique particularly helpful in long fascial incisions, such as lateral approach to the femur, as well as deep surgical fields such as pelvic ring and acetabular fixation. Here's the controlled application of the antibiotics through a fascial rent and a lateral approach to the femur. Of note, the rubber stopper is still intact after deployment of the antibiotics. The small fascial rent is repaired and the remaining wound closed in layered fashion.